I'm creating this as a patient who underwent NPH surgery. Prior to my surgery, I was unable to find anything online from the patient's point of view that would give details on what to expect at the time of and following surgery. I will be sharing photos as I speak. So here goes my surgery. Ventricular VP surgery, to be exact. I'll let you figure out how to pronounce it. Took place at 7 a.m. on Friday morning. Because of unusual situations not caused by the surgery, I received a CT scan, an MRI, and an X-ray while in the post-op, all of which showed no problem. That did, however, have an effect on my recovery. I believe the biggest problem I had initially was from some medication that had me extremely sensitive to sound, like a pin drop sound sounded like a pipe drop. The hospital was not very quiet, especially in the process of being moved back and forth between those different tests. So by the time I got out of the recovery room, I was a mental mess. I was taken into intensive care, and other than having a mild to medium headache, I was under no physical stress. For the first 24 hours, I was on a totally clear liquid diet. That became boring pretty quickly, but as I was on a catheter, they didn't have to worry about me lying around in bed for 24 to 48 hours. Surprisingly, unlike other surgeries I've had in the past, I was not put on an IV drip, which I was very thankful for. They did have me on the simple nose oxygen tubes, but I think it was on a minimal level. In any case, I did not have any problems with oxygen or blood pressure. On day 2, at my request and for my sanity, I was transferred out of the intensive care into a regular room where I could get some sleep. Intensive care is not a place to be when you're trying to sleep, as it is constant noise all the time, all night long. Following the surgery, I only had hydrocodone and tramadol for pain, and those were just oral. Any pain problems I had were just headaches in the area of the head surgery. At that point, I had very little pain in the abdomen from the tube being inserted. However, there was some slight pain flowing down the neck and chest areas where the tube was obviously pushed through. I only spent 2 nights in the hospital, and I was released at 3 p.m. on the second day. Up to that point, it was all just liquid diet, so I was very anxious to get home and get some real food. My follow-up pain treatment was just hydrocodone or Tylenol. Most of the time, I only took half of the hydrocodone that I was allowed and about half of the Tylenol that I was allowed. So the pain was very manageable, mainly on the head incision area. On the 6th day after surgery, the small bandage that was placed over the head incision with 4 staples was removed with very slight pain from that procedure. The doctor indicated that everything looked fine on the scalp and the valve was in place very nicely. I did not tell you about the valve that's placed in my head just behind the ear. The stent in the brain drains into the valve, and from the valve drains down to the abdomen. The entire path is below the skin. You can search out on YouTube or Facebook other explanations of this in much more detail. Probably the biggest problem that I had post-surgery, which was depression and irritability, was, I believe, caused by the anesthesia. That lasted for almost a week after surgery. I don't recall in 8 previous surgeries on most of my body that depression lasting that long, but since I'm 75 years old now, that may be why it had more of an effect. As an aside, I've been under anesthesia for at least 10 times in the past 30 years, and I have a theory that when your awareness of whatever is going on during surgery is removed from your consciousness, that it still resides somewhere in your subconscious brain, and from there it will share those pains at a later date. I think each time that you're put under, it probably reminds the brain of those past times. That's just my theory. In any case, the week after I got home, I think I felt every incision that was ever made on the various parts of my body when I was under anesthesia. Now, this can be a bit frustrating as you wonder, where did this pain or that pain come from? They didn't touch that part of my body in the surgery. If you have had multiple surgeries, share your thoughts. Have you ever experienced such? Well, for a few months prior to my surgery, I had been on CPAP. And following the surgery, I found wearing the CPAP was almost impossible, as the straps came across that surgical area. I had spoken with a CPAP representative about this possibility prior to the surgery. They didn't have any CPAP mask that was designed to avoid that area over the ear and the side of the head. So if you use CPAP, I would suggest discussing that with your doctor prior to the surgery. I had mentioned it to mine, and he said it should not be a problem. I find that not to be true, at least in my case. If this has been helpful to you, please like and subscribe. And if you had such experiences, please share them with me. I hope to create another video after my first round of checkups that's scheduled for April 13th. By that time, my photos should be a little less gross.